Hello to everyone. My name is Rezarta Lalo. I am lecturer PhD at the Faculty of Health, University of Vlora, Ismail Qemali, Albania. The topic of my presentation is the relationship between social support, coping mechanism, and anxiety in patients with non-communicable diseases. Problem statement. Non-communicable diseases, namely cardiovascular diseases, diabetes, cancer, and chronic respiratory diseases, have a higher morbidity and mortality rate globally. The World Health Organization estimates that by 2020, NCD have accounted for 80% of the global disease burden. The European region has the highest burden, especially low and middle income countries, including Albania. About 85% of the overall burden of disease in Albania is attributable to NCD. Furthermore, NCD account for about 94% of proportional mortality in the Albania population. These already dramatic statistics do not take into account the importance of interactions between chronic health conditions and their underlying risk factors. In recent years, mental health in patients with chronic diseases is being considered a serious concern of public health in the European region, with increasing prevalence. The links between mental disorders and major NCD are well established. Patient involvement in the care and self-management process represents a new approach to controlling chronic disease and improving physical and emotional well-being with a positive impact on quality of life. This identifies the need to assess the relationship between social support, self-care mechanism, and level of anxiety in hospitalized patients with non-communicable chronic diseases in the district of Fier, Albania. Research methods, study area, study design, and study period. This is a cross-sectional study conducted in the pathology ward of the Regional Hospital of Fier district during the period June to July 2020. Sample size. The sample included all patients hospitalized in this unit of the age more than 18 years old, of both sexes, and treated for non-communicable chronic disease. Data collection. Anxiety was assessed with the German version of the Generalized Anxiety Disorder 7-item scale with a sum score value of more equal 10, indicating GAD. Scoring criteria. GAD-7 total score symptoms range 0 to 4 points, minimal anxiety, 5 to 9 points, mild anxiety, 10 to 14 points, moderate anxiety, and 15 to 21, severe anxiety. Subscales of the Health Education Impact Questionnaire were used in order to assess participants' self-management capacities and skills. The Health Education Impact Questionnaire is a patient developed questionnaire designed to measure the effectiveness of patient education programs. It consists of 8 subscales measuring coping skills. In this study, we used 3 subscales, which provide a comprehensive profile of the intended outcomes: health-directed activities, self-monitoring and insight, social integration, and support. Each construct-specific questionnaire includes 4 to 6 items rated on a 4-point Likert scale, using the endpoints strongly disagree to strongly agree. The sum of scores for all items is divided by the number of items. Construct scores range between 1 to 4. A higher score indicates better self-management. Construct definitions of the Health Education Impact Questionnaire. Health-directed behavior. This scale is related to a lifestyle change and healthful behaviors, including prevention, diet, and exercise. Self-monitoring and insight. This scale captures the individual's ability to monitor their physical and or emotional condition that leads to insight and appropriate actions to self-manage. Social integration and support. This scale aims to capture the positive impact of social engagement and support that evolves through interaction with others sharing similar health-related life experiences. Statistical analysis. The data analyzed using the statistical program SPSS 23. Regression analysis was used considering a significance level p less than 0.05. Ethics approval. The study was approved by the Research Ethics Committee of the University Ismail Qemali of Vlora, number protocol 102 on 24 June 2020, and Directorate of Regional Hospital of Fier District, number protocol 1685 on 29 July 2020, before the study commences. All aspects of this study have been performed in accordance with the Declaration of Helsinki for Ethical Standards. Results. I describe sample characteristics. The study involved 250 hospitalized patients with a mean age of 64.3 plus minus 7.88 years, range 45 to 85 years old. The majority of the participants were female, 54%. A total of 8 NCD were represented among participants, with diabetes mellitus, 131 patients, heart diseases, 69 patients, hypertension, 26 patients, chronic lung diseases, 6, osteoarthritis, 6, bronchial asthma, 5, anemia, 4, chronic kidney diseases, 3 patients. This is the table related to generalized anxiety disorder 7-item scale. The table shows that 50% of patients were feeling nervous, anxious, or on edge. 40% have been trouble relaxing. 37% were not able to stop or control worrying. This is the table related to GAD-7 score symptom range. Minimal anxiety, mild anxiety, moderate anxiety, severe anxiety. Mean GAD-7 score is 9.5 plus minus 3.5. Minimum 0 point and maximum 21 points. The majority of patients, 52%, had moderate anxiety, 36% mild anxiety, and only 3.2% had severe anxiety. In different studies, it has been observed that the prevalence varies, even within the same country. Thus, in a study conducted by Qemali and others in patients hospitalized in the Vlora Regional Hospital, it was found that psychological disorders were more pronounced in those suffering from chronic diseases, but with slightly lower values compared to our study. These fluctuations can be explained by the influence of several factors, such as the use of different anxiety measuring instruments, sample size, cultural factor, or the prevalence of various chronic diseases. This is the table related to health-directed activity. The results show that 89% don't do at least one type of physical activity. 88% don't walk for exercise for at least 15 minutes per day, most days of the week. This is the table related to score construct range for health-directed activity. Mean score related to health-directed activity is 5.2 plus minus 2.73. Minimum 3 points, maximum 16 points. The results show that 82% of patients have a low level of physical activity and only 10% have a high level of physical activity. This is the table related to self-monitoring and insight answers. The study show that 59% don't know what things can trigger their health problems. 59% don't have a clear understanding what to do to control health problems. 55% of participants don't monitor their health to do what is necessary to keep as healthy as possible. This is the table related to score construct range for self-monitoring and insight. Most score related to self-monitoring is 11.8 plus minus 5.7. Minimum 6 points, maximum 24 points. The study found that 47% of patients reflect a low level of ability to self-monitoring and insight. This is the table related to social integration and support. The results show that 56% don't have enough friends who help them cope with their health problem. 57% of participants say that when they feel ill, their family and carers don't understand what they are going through. This is the table related to score construct range for social integration and support. Mean score related to social integration is 9.5 plus minus 4.95, minimum 5 points and maximum 20 points. The results show that 53% of patients have a low level of integration and social support. These findings are similar to many studies that have shown that physical inactivity, lack of support, and self-management have been considered as potential risk factors in non-communicable disease burden. Relationship between social support, coping mechanism, and anxiety. The results show that there is no statistically significant relationship between the level of anxiety and health-directed activity. But the study found that there was significant statistical association between scale of anxiety dependent variable and independent variables as self-monitoring and social integration, similarly with another study. Above analysis showed that patients with low levels of social integration and low ability to self-monitor their illness were more likely to have moderate and high levels of anxiety, which indicates the urgent need to implement educational programs for their effective management. A study conducted by Larsen et others showed that Health Education Impact Questionnaire constructs served as useful components in increasing the ability to manage chronic disease and reduce the negative emotional effects after participating in an education program for patients with diabetes. Future research will help us to understand exactly the effectiveness of these programs in the control of chronic disease in Albania. Conclusions. The result of this study served as evidence that sheds light on the high prevalence of anxiety in patients hospitalized with NCD in the district of Fier, given that such data in Albania are limited. More than half of the patients had low level of the ability to self-monitor the chronic disease and the social support variables, which had an impact on the deterioration of the psychological condition of the patients. Implementing and involving patients with chronic diseases in educational programs, applying Health Education Impact Questionnaire as a tool designed to measure their effectiveness will be a new approach for health professionals to better understand self-management skill acquired, coping mechanism, and psychosocial disturbances, as well as behavioral strategies for choosing a healthy lifestyle. References of the study. Thank you for your attention.